So what's the history of healthcare insurance in this country?
Well, I got very interested in discovering what all was going on because I had to fight so many issues on every level. Whether it's Social Security supplemental insurance, whether it was a main provider, a good PPO like Blue Cross Blue Shield, and then my father at the VA hospital. I want to say that the VA hospital, nobody could ever give you better care. He got exemplary care. And this is the government doing it and holding the cost down. He got better care there, more cost efficient, effective, which we should care about, than anywhere. I started looking into insurance, what happened. Healthcare insurance, as we know it, my understanding is it started in 1927 in Dallas, Texas, Parkland Hospital. They could see the writing on the wall. During all the boom years, a lot of people had money and they wanted shrines to themselves. So they spent millions to have wings of hospitals named after them and so forth. Well, Parkland Hospital, and then the crash was coming, and with the crash coming, all of a sudden the money was dried up and hospitals were in trouble. The administrator for Parkland said literally they were within 30 days of the sheriff coming and throwing them out. He had before that had a job with the superintendent or with the independent school district for Dallas. So he had some ends there. To save Parkland Hospital, he thought of an idea. He went to the teachers and said, if I can take 50 cents out of each of your paychecks, in return, we will promise you 21 days of care in the hospital for you, your family, or whatever. This was a godsend. This was where people could have health care. It was a wonderful trade. It worked. It kept the hospital going. This was a good idea. Here's the thing. It never included a profit motive, and that's why it worked. It wasn't supposed to. Then later you'll hear how Blue Cross Blue Shield, it started. But it started again because hospitals and things were tied and were a part of and to serve a community, not shareholders, not insurance companies. There was no way the fix could be in. And now we have a system where there's somebody that has a financial interest between you and good health, between what your doctor says and what you say. They will decide. This is wrong. It's inefficient. Think of how you would feel if your house was on fire and you called 911 and they said, well, wait a minute, do you have fire insurance? Do you have house insurance?
Will they let it burn?
Yeah, this is ridiculous.
They're letting it burn right now.
I taught ESL to adults, and I loved my classes. I was a volunteer, also a certified citizenship teacher. And when they learn what America's about and the things that government is about life, liberty, and pursuit of happiness, the government is us. And one thing we band together to do is take care of life, liberty, and pursuit of happiness. And liberty, because we take it very seriously. Somebody is convicted of a crime, their liberty is in danger. We spend a lot of money on courtrooms and attorneys and on all kinds of all kinds of things to protect his civil rights, as we should. But you know something? Some of them are really guilty. Not all of them are innocent. There are guilty ones that we are spending our tax dollars on because somebody's liberty is at stake. What about when somebody's health is at stake? That's life as its most basic. That is government's imperative.